Imagine a receptionist checking in a patient while 3 lines flash red. The physics of Monday mornings guarantee missed calls. This timeline illustrates the bottleneck. A single primary care physician receives roughly 53 inbound calls every single day. As the chart shows, during peak morning windows, roughly 1/3 of those calls are missed or abandoned. Most callers who hit endless hold music simply hang up and dial the next practice in their search results. That is direct new patient revenue walking out the door. The instinctual fix is to add more bodies to the front desk, hiring another full-time receptionist to catch the overflow. But looking at the fully loaded cost breakdown on this chart, an offer letter is only the beginning. Once you stack health benefits, payroll taxes, and the high cost of turnover, a single in-house hire costs $54,000 to $74,000 a year. You can decouple the physical waiting room from your phone lines by routing calls to a dedicated, outsourced remote team. The cloud VoIP system to route those calls runs between $15 and $30 a month per user. The software is effectively a rounding error. The financial math clearly points to outsourcing. However, legally, routing patient calls to remote workers introduces strict compliance requirements that most software marketing pages gloss over. Moving patient calls off-site means your phone system is now a legal conduit for protected health information. Software vendors love to market themselves as HIPAA certified. In reality, there is no government certification for a phone system. The only thing that legally matters is a signed business associate agreement. If a VoIP provider stores a single voicemail, a call recording, or a message log, federal guidelines dictate you must have that contract in place. Without it, the practice faces direct liability and fines from the Office for Civil Rights before a single patient's data even moves. But the software is only half the equation. You also have to secure the physical endpoint where your remote human sits. This flow shows the fastest route to a breach. Allowing remote staff onto personal laptops with shared passwords destroys your audit trail immediately. Compliance requires company-controlled workstations, encrypted VPN tunnels, and software blocking all copying and screenshots. A compliant phone plan is just a secure pipe. It only protects your practice if the remote worker on the other end is operating in a completely locked-down environment. Once the security is handled, you have to decide exactly how calls reach this remote team. For practices hesitant to alter their daily workflow, the overflow model is the safest place to start. Looking at this call path, the patient dials your local front desk first. If the local line is busy or rings too many times, the system diverts the call to the remote team instead of voicemail. This prevents abandoned calls and secures revenue, but your in-office staff still takes the brunt of the daily call volume. Practices looking to free their front desk entirely often move to the first-line model. Here, the remote team answers every single call instantly. They handle routine scheduling and insurance checks, only warm transferring genuine escalations to the local desk. The fastest way to fail with either model is to treat your remote staff like an old-school answering service that just takes down messages. They need direct, secure access to your clinic's EMR. They have to be able to verify insurance and book appointments on that first contact. Because outbound caller ID is handled at the account level, patients always see your clinic's local phone number, no matter where the remote worker sits. True capacity expands when a trained operator actually resolves the patient's issue on the spot, rather than piling up callbacks for the next morning. With your workflow decided, you can map your clinic size and current software stack to a specific VoIP platform. Solo or small practices typically need a safe, well-documented system with a simple setup. This matrix pairs those smaller clinics with RingCentral or Nextiva. They provide clear business associate agreements and straightforward desktop apps that run smoothly under the overflow routing model. Other practices focus heavily on patient acquisition using modern CRM tools, but struggle with the sheer volume of clinical intake. For them, Go High Level is a popular choice, but it carries a specific trade-off. Compliance requires a steep monthly add-on fee to flip on security controls. That fee secures the front desk layer, but you still must keep your actual clinical records siloed in a purpose-built EMR. Multi-location practices face a different challenge, requiring robust audit logs and highly complex routing across different time zones. This points multi-site teams toward enterprise-grade systems like 8x8 or Dialpad. These enterprise systems offer powerful AI call summaries, but you have to verify your contract here, as several AI features are intentionally disabled when you activate HIPAA mode. Your operational maturity and the software you already run should narrow down your platform choice automatically. Solving the front desk bottleneck means expanding your daily capacity without paying for any more physical real estate. Choosing the phone system itself is a minor, low-cost decision. It simply plugs directly into your existing infrastructure. The true investment is strictly securing the endpoints and rigorously training the remote professionals answering your patient lines. You do not need to rip out your entire phone system to fix a people problem. You just need to add securely outsourced capacity to catch the revenue your in-office team physically cannot.